Welcome back to the channel. Today we're diving into a topic that affects millions of people worldwide: lower back pain. That nagging ache, that sharp twinge, that feeling that just won't quit. It's more common than you think, and it's time we understand why. Let's face it, lower back pain can really throw a wrench in your day. It can keep you from doing the things you love, make even simple tasks feel impossible, and leave you feeling frustrated and helpless. But don't worry. We're going to break down the top reasons behind this common issue and give you the knowledge you need to fight back. Over the next few minutes, we'll uncover the most frequent culprits behind lower back pain. From everyday habits to underlying conditions, we'll explore the hows and whys of this all-too-common problem. So if you're ready to finally understand what's going on with your lower back, stick around, because this video is for you. Let's start with something we encounter every single day: posture. You know that thing your mom always used to nag you about? Turns out, she was onto something. The way we hold ourselves, whether sitting or standing, has a huge impact on our lower back. Think about it. Your spine is designed to support your weight, but when you slouch, hunch over your computer, or crane your neck forward, you're putting uneven pressure on those delicate structures. Over time, this constant strain on your muscles, ligaments, and discs can lead to pain, stiffness, and even more serious problems down the road. Imagine a rope being pulled taut for hours on end. Eventually, it's going to start to fray. That's what poor posture does to your back. Now I know what you're thinking. But Dr. Mike, I sit at a desk all day. What am I supposed to do? Don't worry, I've got you covered. We'll talk about ways to improve your posture and ergonomics later on. The key takeaway here is that being mindful of your posture throughout the day can make a world of difference in preventing and even alleviating lower back pain. So, sit up straight, adjust that chair, and let's move on to the next culprit. Now let's talk about those moments when you move the wrong way and feel a sudden twinge in your lower back. We've all been there, right? You bend over to tie your shoe, twist to grab something, or lift a heavy box, and bam! Pain shoots through your lower back. This sudden onset of pain is often caused by muscle or ligament strains. Think of it like this: your muscles and ligaments are like elastic bands that help support your spine and control your movement. When you overstretch or tear these bands, either through a sudden movement or overuse, it can lead to pain, inflammation, and muscle spasms. Now, muscle strains are usually less serious than ligament sprains, but both can be incredibly painful and debilitating. The good news is that with proper rest, ice, compression, and elevation (RICE), most strains and sprains will heal on their own within a few weeks. However, it's important to listen to your body and not push yourself too hard, too soon. Returning to strenuous activity before your back has fully healed can lead to re-injury and chronic pain. So, take it easy, follow your doctor's advice, and give your body the time it needs to recover. Let's move on to a more serious cause of lower back pain: herniated or ruptured discs. Now, these terms might sound scary, but bear with me while I break it down for you. Imagine your spinal discs as jelly donuts. They have a tough outer layer and a soft, gel-like center. These discs act as cushions between the vertebrae in your spine, allowing for movement and absorbing shock. But sometimes, these discs can be put under a lot of pressure. Think about years of poor posture, repetitive motions, or even a sudden injury. This pressure can cause the outer layer of the disc to weaken, allowing the inner gel-like material to bulge out or even rupture entirely. This bulging or rupturing can then put pressure on nearby nerves, leading to pain, numbness, tingling, and even weakness in your lower back, buttocks, and legs. It's like having a pinched nerve, but on a much larger scale. Now, not all herniated or ruptured discs will cause symptoms. Some people might not even know they have one. But for those who do experience pain, it can be incredibly debilitating and require medical attention. As we age, our joints naturally experience wear and tear. It's just a part of life. But for some, this wear and tear can lead to a painful condition called osteoarthritis. Osteoarthritis, the most common form of arthritis, occurs when the protective cartilage that cushions the ends of your bones breaks down over time. This breakdown can happen in any joint, including the joints in your lower back. As the cartilage wears away, the bones in your spine start to rub together, causing pain, stiffness, and inflammation. Imagine sandpaper rubbing against wood. That's the kind of friction we're talking about. Now, osteoarthritis is a progressive condition, meaning it tends to worsen over time. While there's no cure, there are ways to manage the pain and slow down the progression of the disease. We'll discuss those options later on. Finally, let's talk about osteoporosis, a condition that weakens the bones, making them more likely to fracture. You might be thinking, what does osteoporosis have to do with my lower back? Well, it turns out quite a bit. You see, our bones are constantly being broken down and rebuilt in a process called bone remodeling. But as we age, especially after menopause in women, this process can become unbalanced, leading to a loss of bone density. When bones become weak and brittle, even minor stresses like bending over or lifting a grocery bag can cause fractures. And unfortunately, the spine is a common site for these fractures. These spinal fractures, also known as vertebral compression fractures, can cause sudden and severe back pain, as well as a loss of height and a stooped posture. It's like having your spine slowly crumble under its own weight. The good news is that osteoporosis is preventable and treatable. Maintaining a healthy lifestyle with weight-bearing exercise, a balanced diet rich in calcium and vitamin D, and regular bone density screenings can go a long way in protecting your bone health. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. See you in the next video. Remember, understanding the causes of lower back pain is the first step towards finding relief and preventing future problems. Whether it's improving your posture, managing a specific condition, or simply being more mindful of your movements, there are steps you can take to live a pain-free life. If you're experiencing persistent or severe back pain, it's crucial to consult with a healthcare professional for proper diagnosis and treatment. Don't ignore the signs. Your back will thank you for it.